not just as a cancer surgeon, but also working as a the founder of Breast Cancer Foundation and doing some way of giving back to the community. Thanks, Siram, for this privilege and opportunity to share my story and about my book. Really appreciate you taking this up. How do I introduce myself? Basically, if I look back into my life, born to a humble farmers in a small village in North Karnataka, and we had a difficult means to lead a normal life. So from such a condition to be where I am, being the pioneer in robotic cancer surgery in the country, one of the earliest adopters of robotics way back in 2012 when we had one or two robots in the whole country. So I think it's been a phenomenal journey. I would say I always frame my journey as a sequel to scalpel to a scarless surgeon. Today, with AI and technology, we are looking at a scarless surgery, right? With robotics. So basically, I used to handle cutting the grass with a sickle in the village, taking care of the cattle and all that. But from there on, the providence has been given to me. I would say that I could become the cancer surgeon and robotic surgeon. And more than that, I think since I received so much, I've started giving back to the community through the Breast Cancer Foundation, which has touched more than 12 million lives so far across 130 countries. So that I think through that gives so much of satisfaction from my day-to-day job as a cancer surgeon that I'm able to serve people even in the rural areas, the underserved communities, able to reach to them. Launch the country's first mobile cancer screening campaign with the state-of-the-art equipment which goes to their doorsteps. The unreached people, we reach out to them and they do the screening for cancer. I think even through the Breast Cancer Foundation, we've been able to do more than 5 Guinness World Records for scale screening, maybe for breast cancer, oral cancer, or maybe for cervical cancer. So for all these common cancers at scale, we've been able to really, do the screening. So today, if you look back, about 100,000 people a year is what we do the screening through the Breast Cancer Foundation. So that is something that's close to my heart. So apart from that, I think what if you look back at who I am, I think I am someone who's been sent to this world with a purpose to heal the sick, especially those suffering with cancer, and at the same time also to do my part in preventing this disease. I wish I would be jobless a day. Someday I'll be, I no longer have to, do surgeries. That's my, the world, the dream that I have. So how can we prevent this disease? How can we make the cost less for cancer therapy? That's why I started cleansing as one of the founding, directors of a clinical research organization to reduce the cost for drug development and provide access to quality medicine. So I think I do wear multiple hats. So by now you understand that not just being a robotic cancer surgeon, but also being able to be a change agent, to be able to drive the rural cancer care, especially because if you know my story, that we've started one of the uh, very unique cancer center in a place called Nizamabad, and that's where my heart goes out to the district places where there's no access for cancer care. That's where I think I was looking at bridging that gap in the cancer care. So being an entrepreneur has been being a robotic surgeon, being an author, right, and of course, one of the pioneers in cancer screening for the country.
I feel this is really tremendous, and this is what I feel about it is like only a few are blessed by God, and also reading your book. And before even we start the book, there is a very beautiful quote which has come from Rubaiyat.
Right.
And for the sake of audience, I would like to tell that quote, and the quote is like the moving finger writes and having read moves on, nor all thy piety, nor wit shall lure it to back to cancel half a line, and nor thy tears wash out a word of it. And so the thing is like in this particular phrase, what this person is saying, it has been also very beautifully written by, translated again by Harivansh Rai Bachchan. The thing is like if certain thing has to happen, it will happen. And immaterial love, to the extent you pray the God, or the extent you think you have wit or you have presence of mind, once a destiny has been written,
Right.
it cannot be wiped out. And I guess that is where you start your book. And given this philosophy, which has shown as a lighthouse to a good number of people, I want to understand that given this philosophy, how it has helped you to shape your life better.
I think that's a very good thought actually, and because the opening remarks of the book is about the moving finger. See, for a surgeon, it's all about moving fingers. See, the robotic surgery that I do is all about moving fingers, right? The way I move my finger will actually determine the quality of the care that I give to my patient. So now, in this context of the moving finger, see, life is in motion, right? You're talking about destiny, right? So we're all the destiny. We all have a destiny, and once we lose time, you will not get back. So I think it's very clearly mentioned, right? Having great, it goes moves on. You can't undo what you've done, right? But you can learn from what you've done. You can reflect. You can make a right choice, and you can move on. To be a better person. So for me, what I've learned from this is that you can be intentional in giving back to the community. You can be intentional in living a life of legacy. You can be intentional in serving the poor or the needy people. So I think my life's principles are the values are kind of around this principle that you don't get too many chances. Don't waste the opportunity. The chance that you have, you should make use of it. Make best use of every opportunity that you get, so that you keep on touching lives. Don't lose the opportunity of impacting a life. So that's so many of us lose opportunities. A small act of kindness we could do. That time, in the time point, that is gone. You can't. So you can't say that, you can't compensate. You can do many things later, but that was meant for you to do multiple things. But at that point of time in history, you lost an opportunity.
Right.
So in that sense, you know, have the sense of urgency not to lose an opportunity to impact or touch lives.
So I just realized with your answer that to take out the best of the life is to do something now as well. And I guess that is again another similarity with you and other great people is like you are also not wearing a watch. So
I don't wear watch because I'm a surgeon, and for me every second counts, and I scrub for the surgery, so I don't kind of prefer to remove it and keep it pocket. So more than the professional need, I think, as you rightly said, time is now.
So, sir, taking to a deeper dive into your book, and when I specifically talk about, sir, coming from very humble background, and your book talks about that, especially about your education.
Yeah.
So, how did your free education at Navodaya Vidyalaya shape up your commitment to the services? Is it something that schooling or that environment had to give you this track which made you think in this way the way you are?
I think that's a great question, Sriram, because to be who I am today, I think I always look at three important things in my life. One is my mother was prayerful. I don't know what she prayed that I will become a cancer. I do not know, but she prayed that I will be, useful citizen for this great country. That was her, ask. Second, I had a great teacher who identified, that I am meant for doing something more than just grazing the cattle in the field. And right, thirdly, you're mentioning about the school. So the country has invested in Navodaya schools for the first time, right? So the then Prime Minister Rajiv Gandhi, took a bold step that poor students in villages must be given good education. That's how they started Navodaya school, first batch 1986. So I think Navodaya Vidyalaya, the education has given me much more than just kind of a knowledge. I would say it has given me dignity. It has taught me that access is so important for quality education to transform lives. Education is such a big role, and that's where in the school I learned a lot about national integration. How we can live with others, and build an ecosystem and helping each other, serving one another. That kind of a passion I think I developed in Navodaya school, because that was inculcated in us. So we were residential in the school with I mean the best of the best education, but more than that, the values that were taught to us. Right, so I think that has really shaped my life too, especially with respect to my way of looking at giving back to the community and how do we serve others, help others, that empathy, compassion. I think these areas I strongly feel these foundational pillars, I would say, have come from my school at Navodaya.
No, no, absolutely. Your answer that it says, it's phenomenal. And if I have to see, before Navodaya, you spoke about your mother, and you always have been saying that that your first guru is your mother.
Correct.
So I completely agree that Navodaya certainly would have shaped,
Correct.
but learnings from mother
Yeah.
and the culture that you get from your family,
Yes.
I guess that also plays a critical role.
Absolutely.
So coming to the next part, as we go further, you were nicknamed Gandhi, and I understand from the book it is for the kind of frugality that you are used to bring in. So from that perspective, how did that attitude of yours help you to become or create that, how that attitude of yours acted as an asset for you in this cancer care treatment?
Definitely, I think I was not that happy that people used to taunt me or make fun of me. But definitely, I was proud that frugality was part of my life, and that's the reason for some kind of a discipline in my life, self-control. To be able to say no to certain things, to be able to be happy with what you have, be content. I think that's a great virtue. And I think we need to train ourselves to say no, especially the present generation. I keep telling to my children, my daughter also, right? There's a lot of difference between need and want, right? So whatever I want, I don't need. I don't have to. We don't have to give them also, right? So in that sense, for me, what is essential, what is bare minimum required. I think that is where I think I know that this is actually helping me not only just to do my patient care, but also to serve them better with empathy and compassion. So, I mean, you see, today there's always a conflict of interest for people in any profession, for that matter. What I call it as intellectual dishonesty, right? When your needs are met, when I consider myself, I'm the richest man on this earth, right? I don't really do things which are not necessary. So you can do an ethical practice. You can do what is best interest of the patient is always a priority for you. If you have this contentment, as your way of life. Right. So in that sense, for me, what is best for the patient is the top priority. Then, in what way can this situation help me, or how can I exploit the situation for my good or for my requirements, or to even for that matter earning more money. So money is never a driving force for me. So not even the success. Success is always a byproduct, right? So for me, I think the sense of frugality has helped me to be a better doctor, a better clinician, with ethics and giving the right kind of care to my patient.
This is really phenomenal. Especially, you hardly find people with that commitment who say that my preferences of what are my preferences are secondary. I don't really care about my preferences, and also not only saying but believing and practicing in a way that that success is byproduct. Now, as we further read your book, and I feel this has got also something wherein the advice that you got from one of your professors, Dr. Prahlad Rao, and during that challenging time that you were facing in Surat.
Right.
So what exactly is that?
Well, it's a nostalgic moment for me because I was doing my MS residency there, and the young patient with stomach cancer. We tried our best, but we could not save. And this man was a chronic smoker. So I was worrying that if only this man had quit early or somebody intervened for him to stop smoking, probably would have been better off with family would have not missed him. So with that I was really very much depressed and down, and that's when Dr. Prahlad Rai came to me and said, you know, I think you don't. He put a hand on my shoulder and he said, "You don't, look at this as your personal challenge. This is a, national challenge, right? So prevention and this education awareness is required. But again, having said that, the cancer is a complex phenomenon. It is not something that directly, not every smoker will get cancer. But same time, people, it's a very heterogeneous disease wherein the genes have a significant role to play, and some of the triggers like smoking will come into play. So he actually explained to me in a sense that you're not responsible for what has happened to him, right? He is responsible for his fate. So you don't worry, you don't cry over it. You don't get emotionally drawn and sullen. I mean, in a way, he said that each one is responsible for his actions. That you need to keep in mind. So that was something that he ingrained into my mind, and he taught me some of the amazing principles of surgery and the patient care. I think that is something that I really cannot forget today. Patient post-op care. Anytime he comes to the rounds, patient must be up and ambulating or doing a spirometry or doing a movements. Some of the fundamentals, but they have a profound value for the outcome to the patient. So in that way, this great teacher has shaped up my surgical career, I can say, and hats up to Dr. Prahlad Rai.
So this really means a lot because as I don't know if you got a chance, but as we said, that we have to work towards the action. So even the Gita says that we have to follow what we have been asked to do, or what I have to do my actions, the karma part, and very rightfully saying that everybody has their own karma to play. So if doctor has that, the patient has theirs too, by abiding to the things that will help them, and absolutely. And I certainly see his contribution. You becoming one of India's finest cancer surgeons, so definitely you got great mentors, and not only that, they did that karma of teaching, but at the same time, you did your karma of being a good student and implying that as well. So now coming to the next part of in the same lesson as we go. So I wanted to also understand that the importance of mentors in GCRI. I guess there are a set of mentors that you had there, and there were some great learnings there. So if
Yes.
you can please share that.
Surely, Sriram. See, GCRI, the Gujarat Cancer Research Institute in Ahmedabad, has been one of the pioneering centers for cancer care, and highest volume of cancer care happens there actually. And that's where I was fortunate to be trained for my super specialty, the surgical oncology training for 3 years, and my PG teacher, Dr. J.T. Jala, and of course I also had an amazing teacher in Dr. J.D. Patel, Dr. Mukul Trivedi, and of course our HOD was Dr. Shakuntala Shah. These four mentors, I think they have taught me not just how to do surgery, but also they taught me when not to operate. Okay. So a good surgeon knows how to operate, but the best surgeon knows when not to operate. So they have actually kind of inculcated in me that wisdom or that judgment of when not to operate and when to operate. So I think some of the skills that I have learned is from them, especially Dr. Jala or even Mukul Bhai, and of course Shekuntala Ben was one of the most one of the prolific cancer surgeon of the country. I would say she has taught us how to use cautery or the electric energy that we use to cut the tissue or the blood vessels boldly, confidently, without causing any damage and doing a good clearance. So I think they have had their own great share of influence in the way I have learned the art of surgery, because surgery is not just a science, right? I mean, it's not just a theory, right? It's all about what you do in terms of the actions that you put it in the theater, right? So in that way, I mean, this art I have inherited from these great teachers.
No, this is phenomenal, and while talking to you, it really means that I have heard that it's God who decides that who is the best candidate to do certain thing. And while you take so much of pride to talk about your professors, your doctors who have taught you so much, this just makes me nostalgic of seeing old episodes of Mahabharata, wherein Arjun would stand up and say, "You is not only doing phenomenal job of what you are supposed to do, but you also take pride about great teachers who have taught you this art and where you are excellent."
Now
Is that
let me pause you here and share a small story about another great teacher in my school. As I said, I come from humble backgrounds, walking barefoot, a small, to a nearby village about 5 kilometers. First time in the country, Navodaya concept came. The teacher said 5 people will write the exam. Out of that, I had a desire that I also should write, but till then we never heard of something called entrance exam. Never went to a city or a town. So deep inside there was kind of that conservative mindset that no, I'm not capable. I'm not someone ready for that. That's when next day the same teacher comes back and says, out of the five, three are disqualified. Only two will write the entrance exam, right? No, because again, I'm connecting back to the moving finger, right? How the destiny, what will happen, right? So at that point of time, out of five, three were disqualified because of the date of birth and age, eligibility criteria, nothing else. Because capability, no one knew who know how capable they were in that sense. We're all at par. Nobody was superior and inferior to anybody in that sense because there was no metrics also, right? So that's when he was about to close these two names and about to leave the classroom. An elderly gentleman by name Jayappa, my teacher, he enters into the classroom. I had a desire deep still, three are disqualified, but didn't have the courage to stand up. He enters into the classroom, asks him how many are writing. He says two. This man looks at me and says, why not this boy write? And the rest is history. So that is the kind of influence a teacher has. So that's why I have immense regard and respect for the teachers.
I always felt that it's teacher that is the person they are right amount of fertilizer,
Yeah.
maybe the right amount of water.
Yeah.
Means you may have a deep down a seed or thought that hey, this is what I want to achieve, but until unless a teacher comes in your life,
Yeah.
and nurtures at different stages, you can never reach that potential that you always want.
Absolutely. Absolutely.
So also coming to that, and since we have also heard about, about your teachers, you growing up and all that stuff, and in your introduction you have spoken about the Grace Cancer Foundation, and what I understand is there's something that inspired you about that your 4C mandate, which is cure and compassionate, commitment, care. These are these 4Cs that you're talking about. How they play a role in Grace Foundation?
See, the Grace Cancer Foundation, many people think actually mistakenly that it started after my mother. No, she was very much alive when we had the foundation started way back in 2013. So the 4C concept of Grace Cancer Foundation is care, cure, compassion, and commitment. So the singular vision is how can we alleviate the cancer burden in the communities. To do that, it's not just the knowledge is enough, but we need to have a compassion. We need to not just provide the care and cure, but we need to give compassion, and you need to be committed to do that because it takes a lot of hard work. Every weekend, me, my wife, my kids, foundation volunteers, we are able to go to a rural area for the last 15 years through the mobile screening buses that we have started, right? So we need to be committed to care for them. We cannot. So with these four pillars of the way we deliver, right, our vision to achieve our vision of reducing the cancer burden in the communities, we work through education, we work through early detection, providing treatment, and also looking at rehabilitation. So these are the four pillars of our mission to achieve our vision, but through the values of providing care, cure, compassion with commitment.
So absolutely means I guess these are the four most important pillars that you can really think, because as you rightly said that a person needs to be it's a person needs to be taken care of properly, and if you really think from a perspective that something happened to some person wrong because of health and something, and until unless a foundation comes in and if it does not have these four pillars,
Yeah.
a person will feel that hey, I'm left somewhere.
Yes.
Wherein nobody is there to take care, and from that perspective I guess really this force is they are really miraculous in that sense. So furthermore I wanted to understand, you were first few in the countries to talk about robotic surgery, and how has that technology changed the practice, especially in terms of surgical oncology?
Definitely, I think the robotic surgery is a game changer, I would say. When I started robotic surgery, many people thought that this is more of a corporate gimmick, something to just kind of sell their product, or something to just kind of sensationalize, like something like a breaking product that has come. But today, if you look back and see, robotic surgery has been there in the market for about 25 years now, and we have millions of surgeries done globally successfully. I think how do you really say whether your robotic journey is good or not? I think I will only look at one thing: what are the outcomes to our patients, right? So what is it that we have given to our patients through this robotic technology? I think that one thing, the patient value, what's what I call, right, is actually something that I can tell you it reduces the hospital stay, it reduces the pain, it reduces the blood loss, it reduces the the use of many analgesics for pain, and it also enables the patient to go back early to their jobs. So basically, robotic surgery is a precision surgery, right? So you are actually preserving what not to be removed and doing a precise job, right, through minimally invasive nature. That means that through small keyholes. Many of our audience would know about laparoscopic surgery as well, right? It's a keyhole surgery. But what differentiates robotic from laparoscopic is that you have a beautiful vision, 10 times magnified vision, and a 3D view, right? So there's a binocular vision, 10 times magnified view, and of course you also have the instruments of robotic technology are not rigid, unlike in laparoscopy. So in laparoscopy, basically it's not a keyhole surgery, but you hold the instruments, look at a TV monitor, and then operate. So rigid sticks you hold and you operate. So it is not as precise. At the tip, it won't have a movement. Whereas in robotic instruments, there's a fine range of motion. The instruments can literally dance in the abdomen. So in that sense, it is a precise surgery. More complex surgery can be done with less cut. So gone are the days wherein big surgeon, big cut. Big incision, big surgeon. That was the good old kind of a understanding. But today, a big surgeon or a great surgery is done with small incision. So that's where I think the patient value is tremendously increased by minimally invasive surgery, and that too with the advent of robotic surgery.
Actually, said this really also tells me from a perspective of like in your book, especially talking about lifelong learning, and I guess it's something like leaders like you, those have been demonstrating. In Satyam, we were told in Satya Computers that a leader is not a person who actually instructs. A leader is actually a person who shows that this is how I am transforming, and I'm opening a way so that other people can see, and they can also become a leader. So I guess in that way, embracing the technology right from the beginning so that it saves people more absolutely shows that passion of learning, shows your capability as a leader. So further coming to this point of about talking about learning and leadership, in your book, can you briefly explain from your book the four steps of learning process and how it is important for you?
I think I'll go a little bit off bit also in terms of how I, got learning as an important thing in my career. Uh, when I went for a training for robotic surgery in one of the best cancer centers in the world called MSKCC, Memorial Sloan Kettering Cancer Center, and of course also I went to Buffalo Cancer, hospitals in Buffalo. I mean, it's called as the one of the best centers for oncology training actually. So what I understood is that in one of the theaters, I found a nice, frame in which it was written like this. You know, perfection is the goal. Excellence will be tolerated. That hit me hard. There is no excuse for excellence. You may not be perfect. Each one of us have our own flaws, right? We aspire to be perfect. It may take our lifetime. That's okay. You need not feel sorry that today we are not perfect. We are imperfect. But there is no role for mediocrity. Right. So right, excellence is something that you need to embrace. So that's the reason I've embraced robotics as a technology evolved. Robotics I've embraced, and then of course now with the advent of artificial intelligence, I think you are part of all the conference that we've had just a week ago, right? So how AI is also transforming, so that way also I'm actually learning a lot about technology now and how AI can really make meaningful difference to our patients in terms of the outcomes. So I think that's what you need to have that passion to excel. Then you're a lifelong learner. See, as a surgeon, every surgery is different for me, right? Every patient is different. Not necessarily technically the same surgery in terms of the name, nomenclature, and all. But when I actually go to the patient is different. The tissue is different. The planes are different. So I encounter each. So that in that sense, if my standards are not for excellence, I will be doing actually injustice to the patient. I would rather not take up the patient for us. So I think that has been my driving force, to excel. That will be tolerated.
So, as a very caring person for the society, what was the motivation that you had and the impact of co-founding this sync company to
Mhm.
create affordable, cancer drug. So what was in your mind?
See, I think as we all know, cancer care is an expensive proposition. It's not just the financial toxicity, the biggest toxicity, I would say. Because it's not just the chemo toxicity that patient endures, but the financial toxicity for the whole family,
Yeah.
right? So I think because today the medicines are expensive, the cancer care is not cheap, right? So my only sense of urgency in me was that can we do some research in such a way that these expensive drugs are you know kind of given to our patients at a much lesser cost. So that's when I think clinical research synchronizing with the drug development. That was the name for cleansing. So we started way back in 2010 with like-minded people, along with a couple of oncology doctors and friends. We started this organization, and we were able to meaningfully work on some of these drugs which are expensive and make them available to our patients today at a very maybe 10x cheaper than their original cost. So I think that has been the driving force because I have seen many people don't complete the treatment because they're not they're not able to afford for the cancer care the cost of the treatment. So I think that's where I strongly feel the access to medicines cost plays a significant role, and we're able to bridge that gap through cleansing.
It was a really wonderful, I guess there are very few people in India, especially if we talk not only India but across the world, who would really think about that how to bring down the cost 10 times so that actually it becomes affordable. And it's I would really say that it's actually your upbringing, for that matter, to really think of everybody. Even if I would say that it's nothing to politicize here, to say that that the prime minister says sabka saath sabka vikas,
Mhm.
but I feel that is really a saintly thought of thinking about hey, how can I bring down cost of everything that can save somebody's life. Brilliant, sir. So now that we were, sir, as we were talking and discussing the earlier question, MSK came into the picture.
Mhm.
So I wanted to understand, what are the biggest obstacles in India that are stopping us to achieve this dream of building our own hospital or something like in the lines of MSK.
No, I think that is today India is a global player in every sector. So in healthcare as well, we have medical tourism coming in a big way. Many of the patients from Middle East, Africa are coming here. More than 50 or 60 countries. Many patients are coming here for the treatment. So apart from that, I think for our own population, right, we are such a huge country. So we need institutions like MSK. But I think some of the hurdles or the barriers that I find is one thing is to run anything, especially for the marginalized people and making it affordable, giving the right access to everybody. I think finances is an important part. It is less said than what it has to be, right? So today people say there is money, but there is no people. We need the right people. Different people are there. Money still plays a role, in establishing such institutions, right? So I think apart from that, I think we need priority in terms of the social barriers that are there. People today don't get screened. People do not get themselves ready to come forward for the early detection. So given all that, I strongly feel even if the financial barriers, social barriers are there is a place for institutions like MSK in this part of the world. Because I think in the West, a lot of giving or the those campaigns have withstood the test of times in the last couple of centuries. You see some of the big institutions, right? Maybe any global institutions. Such institutions, I think there is more to come in this part of the world. That's what is my desire, and maybe one day it will come to fruition.
So, given the population of India, given that we really don't have exact numbers in India, but saying that around 1.5 million people suffering from cancer, which is as good as close to population of Bahrain, and we see that the numbers are going to double by 2040, I certainly agree that we require more such institutions to come and to take care. Also, given that, usually what happens, like when we are talking or interacting with other guests, uh, we really don't ask questions which will really directly benefit or help the audience in a way that they can be safeguarded from certain things.
Mm-hmm.
So today, as you said, we are especially blessed to have you. I wanted to have some three questions
Okay.
before we get to the closing section, that about the health, right? So from that perspective, beyond quitting smoking, what are other most effective ways in lifestyle that a person can do to lower the risk of cancer?
Well, I think it's a very pertinent question. So on a doctor's day, you're asking a right question, especially how do we prevent cancer? How do we, have a healthy lifestyle, right? Apart from smoking, correct? Because we've all seen tobacco as the big victim and a villain for cancer. It is definitely 40% of the cancers can be, reduced just by avoiding tobacco, whether smoking or chewing. In this part of the world, chewing is pretty common other than smoking, right? So I think that is done. But apart from that, what else is there? If you look at, I think alcohol incidence is increasing day by day. If you see the younger generation, significant consumption of alcohol, lack of physical activity, right? So people today, we are living in a world of where everything is connected, hyper connected world, right? At the touch of a button, food comes to you. You don't have to even go to your kitchen, right? I think we're becoming more lazy in that sense. Physical activity is coming down. See, some of these things what I'm mentioning are not costly. They're very simple changes that we can make. Quitting from habit like alcohol or moderation. I cannot define what is moderate alcohol here. Actually, I for one say it's a risk factor for sure, right? So the physical activity is important, and of course the diet. Again, unlimited lunch, unlimited dinners. So many restaurants. The what you eat.
Mm.
So people must focus on the diet. You should go for the organic, go for the green, leafy vegetables, go for vegan diet. I think this shift is important today, right? I always say one important formula. I call it as a 4-4-80, right? Four modifiable risk factors leads to four non-communicable diseases, accounting for 80% of the mortality or deaths.
Amazing.
So these four are modifiable risk factors, right?
Yes.
I'll name them both four, right?
Yes.
So four modifiable risk factors. One is we have already said smoking, correct? Number two, alcohol, right? Number three, diet,
Yes.
right? Number four, physical activity. So these four are modifiable within our hands.
Right.
They lead to four non-communicable diseases like cardiac, diabetes, pulmonary or the lung issues, and cancer. So cancer, diabetes, cardiac, and lung conditions, non-communicable diseases, which account for 80%. So if we focus as a nation on these four factors,
Yes.
which are modifiable risk factors, we're actually avoiding 80% of the mortality with these diseases.
Amazing.
So I think some of the fundamentals, many times what happens is that we know we heard of it, but it's just that we don't inculcate or make it a habit. I think that's where we need to be conscious about our diet. We need to be conscious about our physical activity. We need to be conscious about our habits. I think if that discipline is, kind of driven deep inside us, wherein it is actionable, great change will be there, and we can reduce these diseases, not just cancer, but other NCDs.
No, I completely agree, sir. I actually was reading a book on eating habits. There is a book actually of Mahatma Gandhi which also talks about his diet.
Right.
And the thing is, like in that book, it talks about that he used to eat marrow of wattle goat.
Mm-hmm.
He used to have grains of wheat, soaked wheats in the morning. And I was really thinking that if you really have to digest that kind of a food, how much that person has to work. And interestingly, in that book only you learn that his work on the fields, there were farms, there were fields where Gandhiji used to work, and on an average, he used to walk 18 kilometers a day. So I guess that was the only reason for him to say that with my kind of a lifestyle, I guess I can survive 125 years. And I guess the answer, not guess, but I'm very sure the answer that you have, or the method you have suggested about 4, 4, and 80.
Right.
I guess if people can follow that, I guess their life would be safe. They can, stay assured that they can have good family time,
Yeah.
and take care of things. So coming to the next thing, especially now, what is happening is I would like to know that what are the key cancer screenings that a person of my age should really think, and how does it help, or how does it even if you have to take family history into the account, what would you suggest in that?
Definitely, I think this is a very important aspect that you touch. Screening for cancer in this part of the world, especially in our country, it's not even done by 5% of the population. So screening is basically what you do certain tests for normal people to catch if the disease has come begun in their body without any symptoms. The reason why do you do screening is many times by the time patient feels the symptoms, it can be advanced also. Sometimes initially there may not be symptoms. Right? So in that sense, it is wise to detect the disease even before you have symptoms. Because if you are early in early detection, right, you are able to actually cure the disease. See, we know the outcomes of cancer depend on the stage 0 to stage 4. So the earlier you are in the stage, the best are the outcomes. In this part of the world, even it's sad to say, with so much of advancement and with so much of the power that India has, 60 to 70% of our people are still diagnosed in stage 3 and stage 4. So that means to say that we need to shift that towards stage 0 to stage 1 or 2. So that is possible, if only we give importance for screening. So screening based upon the ages, based upon your age, we can define certain tests. For example, every woman above 40 years can get a mammography done for breast cancer early detection. You can't screen for every type of cancer. There are more than 200 types of cancer. But except your hair and nail, any part of the body cancer may happen. Right? But that doesn't mean that you start living with that fear every day and worrying whether you have this cancer or not. That's not necessary, right? You don't have to live with that fear, right? You can live with confidence and hope that if your habits are right and if if God forbid if you're destined to get one, you will get one. You can manage. But thing is that you need to be proactive in screening to detect if at all it has begun. It can be detected very early. So as you were asking now, for above 40 years, we can get a mammography done every year, right? And for every woman above 30 years, we do something called as a pap smear, right? That is to detect the cervical cancer very early. Right? That can be done a simple brushings of the cells in the cervix or the mouth of the uterus can detect the cancer very, very early, even 5 years, 10 years before the actual cancer begins. Similarly, for male, you were asking about yourself, right? So if you're above 40, right, above 45, you can get a colonoscopy done once every 10 years. It's not something that you do it every year, right? Above 50, prostate cancer is common in men. Get a simple blood test called PSA, right? So, oral for somebody who is a tobacco addict, oral examination helps us in identifying whether oral cancer is begun or not. So, I think these tests are based on the age group you belong to. But above 50, I think getting a colonoscopy, a PSA, and oral examination and master health checkup, I think that goes a long way in identifying the disease very, very early.
Also get these kind of tests done. And I'll also request everyone who's watching this show that certainly get screening done, because as sir rightly said, about 60% of the cancer cases that we get to know or are detected are in later stages, and it becomes really difficult to save yourself in such a situation. So please be kind to yourself and please do get yourself tested.
On that note, I want to add one important, statement by Shakespeare. He says, "Self-love, right? Self-love is not so vile a sin as self-neglect."
I agree.
So you need to take care of yourself. Love your body. Take care of yourself. It's not wrong. It's better than self-neglect. I think that much you need to take care because this body is temple of God. I say, right. So you need to make sure that it is pure. It is some which is neat order. Right. I think you need to take care of that. I mean, I think that much of selfishness is okay. Not in other areas, but in this.
No, absolutely, sir. I agree. And there is another angle also in which I say to what you just said. There's like, at the end of the day, this is the instrument that God has given us.
Correct.
And if you even don't believe in God, it's like the space the universe has given us to achieve certain thing in life.
Correct.
And if we destroy this particular instrument, I guess the whole point of getting to certain destination will be
Correct.
left in some kind of a disturbance. So I guess that way.
That's where moving finger again comes to the picture.
I agree. So, coming to this, especially while we are talking about in this health section, my last question to you in this will be: so, what is the most promising future advancement in cancer, especially in terms of prevention, that can be used in early detection? Is there something else also coming in?
Yeah, I think a multi-cancer detection blood test is coming up. It's under research still, not yet coming to the practice. But I think a lot of trials are underway in the US and Western countries, where with a simple blood sample at a molecular level, you'll be able to know or trace whether cancer has begun or not. So this is not just for one cancer, because today you can't screen for every cancer. Each cancer behaves differently. So, but one blood test can say whether you have a particular cancer, any cancer anywhere in the body. I think that is something which is going to be exciting and coming up very soon. So I'm looking forward for that as the next big innovation in oncology to be able to say with a simple blood drop, cancer is there anywhere in the body. Of course, I'm also looking at telesurgery to be a reality soon, wherein I'll be working from home. So my robotic console will be at home. So I'll be operating from home, and just like the IT experts are now working from home, right? So we'll be able to do surgery from home, right? And we can operate to any remote parts of the world. So underserved communities will be able to give your services and do a complex surgery even from remote parts. So that's, I think, that will be also again the next exciting thing that we are looking at in the near future.
I really feel that this kind of technology upgrade is actually needed. I would especially like to also thank you for writing this book, and also your co-author Mr. Tiwari,
Yes.
because as you very rightly said, and I guess he also captured this while writing book of Mr. APJ Abdul Kalam, is like the use of science in terms of like APJ Abdul Kalam is saying that when even you lit a cracker and there are beautiful colors that make you feel that hey, this is something beautiful, this is something different, from that extent to saving somebody's life. So I guess that is what is the beauty of science, that if it can at certain point in time entertain to the extent of saving somebody's life, I guess that beautifully captures it. So coming to the last section, which I ideally did not want it to be, but I have a couple of this interaction going so well. I have a couple of questions there also. So, sir, especially in this section, I would like to know what is the single most important message that you would want your readers to take from this book of yours?
Well, I think if I had to give a single message, it's in the title: live for legacy, right? So I want to define legacy as not that not something that you leave for others. Legacy is what you leave in others. There's a huge difference. See, people say, he left a legacy of $1 million to his children for them. But right, if I show love to somebody, if I show compassion to somebody, I serve somebody, I help somebody, it is something that I leave in them. So I think it is not about reputation. Reputation can be purchased, but legacy cannot be. It's your lifetime that you invest and you're credible. What who you are actually, right? It will be shown up in different point of times. You cannot fake your true identity, the person who you are, right? So I think that's where we all have this beautiful life. We should aspire to live this life, to leave a legacy. Live to leave legacy. Unless you live, you cannot leave. So to live, you need to live, right? And legacy, in that sense, is not what you live for others, but what you live in others. I think if you have that perspective, the world will be much much better place to There's always a shoulder to kind of hang on to, and life is so beautiful.
So actually, this particular answer of yours actually reminded me of a very beautiful story from Mahabharata.
Mm-hmm.
So, and it tells why once Arjun was asking Krishna that what is it that Karna has done? Why is it that I always feel that you like Karna as one of your most favorite characters? And so what happens is like the answer is very much similar that Krishna gives what you just now gave. It is like that what he is known to give. Means he is leaving that legacy that people know. If you go to Karna, it's done. From that perspective, so he is living that legacy of doing for people, doing for others, never caring for the self.
Right.
I guess that the answer that you gave about your book, and I completely agree. I really can't agree more on that. Also, coming on to the next part, the last question of this interaction that we are having. So, based on your definition of spirituality in this book that you're talking, And talking especially in terms of prayer, what is that when you say that, you're saying that, you are the instrument of the God to the world. So what's that?
I think, Shiram, one thing that I, always believe is we are all vessels in the hands of God. Right? We have a creator, whether you believe in whichever, maybe your subscription, faith-wise, but right, we have a creator. And he has sent us to this world with a purpose. So our life should be a purpose driven. Right? So that purpose should be accomplished. We keep exploring purpose at different phases. It's not that when you're born, there's a written purpose given to you. You keep exploring, but for that purpose to to be able to know, you need to be connected. If you're disconnected, you will not know. You will go randomly, hey, where you do this, do that, and then you'll be lost. So, but if you are an instrument in the hand of God, you are a vessel which brings honor to His name. Right? See, everything that you do, the first priority in your life should be your God. Right? So then only your family comes. Then only your spouse or kids, right? So two things, right, which bring glory, which brings honor to God. I think that is what is purpose. To know who you are, know why you are here, know where you are heading to. Right? I think that is the fundamental essence for any profession, anybody for that matter, right? You are in this world. Where have you come from? Why are you here? Where are you heading to? I think if you know these answers clearly, I think then you will pursue your purpose with much more passion, and you will achieve it. So that in doing all this, actually, you are showcasing that you are an instrument of God. Now, people say whenever I treat a patient and come out from theater from complex surgery, we have not seen God, but we see God in you. Right? It's not that we are God; we are only instruments in the hands of God. I'm not trying to take away the the credit that belongs to God, or the supernatural power that you're looking at. But each one of us are given this privilege of being instruments of God to do what He wants us to do. I think that alignment is important to understand, to be connected with Him. Right? I think today we are living in a disconnected world. Right? Today people think spirituality is something of the old age kind of not anymore relevant. No, today we have millions of people around us, but people are having to suffer with loneliness. Today we have so much of people all around, but loneliness is a big issue. Right? You're all alone. You're struggling. So I think the best solution, I would say, is to be an instrument in the hands of God and obey, surrender, and live that life which honors Him. I think I think that is the essence I feel at the end of the day. Once you go back, He should say, "Well done, my faithful servant." All other accolades, everything is a vanity fair. Awards, records, all everything. But at the end of the day, whom are you trying to please?
I agree.
Right. So I think that's where I look at the final verdict that you've done well. That's a life of legacy.
I completely agree. Means I actually, your thought on this question reminded me of a Christian prayer. I don't know if you have heard it or not. This is, "O Lord, all the world belongs to you, and you are making all things new. What is wrong you forgive, and then the new life you give." So, with that, I would like to say, so thanks. It was a truly honor to have such a legend on our show who has in phenomenal service, saved tons of people from this disease, and is on a crusade to save more by doing more and more of charity, taking cancer care to villages. I'm really honored and I feel privileged that you could take out time out of your busy schedule to talk about your life journey. And I would request everybody to go and get this book. This is one of the finest books that you will come across, which says that live for legacy.